Hi, my name's Mary. I'm one of the nurse care coordinators. I work with primarily the Medicaid population. I started working with one of these particular patients a little over a year ago. He has some cognitive deficits, and so he has a healthcare caregiver agency called Stepping Stone. They oversee his finances, transportation, and other aspects of his healthcare. When I started working with him, he was unable to relay his medications correctly to his physician. So we started getting him a home care nurse that would come in on a daily basis to help administer his medications. I worked with him in his home to do a med rec and was able to relay this information to his primary care physician so that she could update his medications accordingly. Shortly after that, the patient was hospitalized frequently over a short period of time. It was found that he was not taking his medications correctly, and so we were able to work with the home care nurse on adjusting this. The Stepping Stone program director stopped returning my phone calls over a period of several months, and so I came into an office visit with him and his primary care provider and found out that a new program director had started. I was able to get one of our care coordinator social workers involved due to some of his concerns with his pension and retirement and getting him initiated with Medicare. After that, we found that the patient's home care nurse had been administering his medications incorrectly. I did another home visit and confirmed that he was not getting his dose of Lasix as the doctors had wanted. We got a new home care agency started with him, and we're able to make sure that he didn't have any days of care missed, so that he wasn't missing any of his insulin doses or his blood sugar checks. I was able to call the cardiologist, his primary care provider, his Stepping Stone agency, his new home care agency, as well as his pharmacy, in order to pull all of his medication lists and cross-reference them to make sure that there were no discrepancies. After we cleared that situation up, we started getting him transitioned to a new pharmacy called Exact Care that was able to prepackage all of his medications so that the nurse wasn't having to separate his medications out for him on a daily basis. We are now currently working on getting him able to administer his own insulin and check his blood sugars so that he won't be reliant on the nurse in the next few months. His case is ongoing, but hopefully the collaboration continues between all of his aspects of care.